Hello, my name is Sherry McCrae, and I am a DMP student at King University, and I'm going to speak to you today on a critical issue in the field of nursing, which is the need for more BSN-prepared nurses. The objectives of this presentation include that the participant will be able to describe the criticality for increasing the percentage of BSN-prepared nurses. Also, they will be able to discuss the literature findings that support this issue, list the benefits of holding a BSN degree. They will be able to recognize individual and societal realm benefits of BSN education and identify ethical principles affected by the RN level of education. And lastly, be able to relate to the evolution of thinking regarding this critical issue. The landscape of healthcare is changing drastically. The nursing profession must be prepared to handle these changes and keep up with this complex field. Significant research exists supporting the need for more nurses to possess a BSN. A BSN-rich workforce is beneficial for both patients and for nurses. The IOM Robert Wood Johnson Future of Nursing Initiative recommends that 80% of nurses be BSN prepared by the year 2020. Their key message number 2 states, nurses should achieve higher levels of education and training through an improved education system that promotes seamless academic progression. History has not changed regarding the goal of nursing education. Always, we have thought that nurses should be able to be prepared to meet diverse patient needs, function as leaders, and advance science that benefits patients and the capability of health professionals to deliver safe, quality patient care. In 2008, only 36% of RNs held a BSN. So how do we get there? How do we close this huge gap between 36% and 80%? Obviously, it is going to take all stakeholders working in a concerted effort to remove the barriers, which include cost, work schedules, and the benefits that BSNs have post-graduation. The stakeholders include educators, administrators, and policymakers. Here are a few facts which compare the ADN to the BSN. BSN students have better critical thinking skills than ADN students. Pass rates for the NCLEX are higher with BSN students at 88.1%, compared to 86.6% for ADNs. Unemployment rates for ADN nurses are higher than those of BSNs, and BSN nurses have a higher job satisfaction than ADN nurses. These two facts alone contribute to a higher turnover rate among ADN nurses or a higher retention rate with BSN nurses. BSN nurses are able to work in a broader scope of settings, and salaries are approximately $5,500 annually higher for BSNs than ADNs. The first discussion question I want you to think about is, do you believe that the statements made on the preceding slide support the need for an increased percentage of BSN prepared nurses? Here is a graph which shows the percentage of, well, it's actually the number of RNs in thousands of nurses which hold different degree levels. As you can see, between 1980 and 2008, the number of BSN nurses is steadily increasing. The number of diploma nurses is steadily decreasing. And also of note, nurses obtaining graduate degrees, whether that be a master's or a doctorate, is trending upward as well. The individual realm is affected by two different groups who will benefit by having more BSN prepared nurses. And those groups are nurses themselves and the patients that they care for. Nurses enjoy a greater job satisfaction, better pay, and increased career opportunities. And BSNs provide care to patients, which results in better patient outcomes. In the societal realm, there are two components which are positively affected by an increased percentage of BSN nurses, and those are improved healthcare quality and decreased healthcare cost. The Patient Protection and Affordable Care Act of 2010 produced a complex set of mandates. A wider variety of competencies are required to meet these, which include health policy, healthcare finance, leadership, quality improvement, and systems thinking. Each of those competencies are included in the education that most BSN nurses receive. Therefore, BSNs have the necessary training to care for our changing society. There are two ethical principles which are affected by degree level with nurses. Proper training is paramount in avoiding ethical dilemmas. Not only do BSNs receive more time studying ethical principles, they receive a more well-rounded, all-encompassing curriculum that provides the necessary basis to avoid ethical pitfalls. Non-maleficence and beneficence are two ethical principles that provide a lens through which to examine this critical issue. First, we will talk about non-maleficence. Healthcare professionals are often in a position to cause harm in the course of attending to a patient's needs. Obviously, nurses set out to first do no harm, but somewhere along the line of caring for patients, harm can happen. Nurses do not want to cause harm to their patients, and this is true of both ADN and BSN nurses alike. Concern about making an error and harming the patient, limited knowledge and skills for practice, and difficulties in interacting with the teacher and others in the clinical setting are some of the stressors reported by students. Students in ADN programs have an increased stress level of those in a BSN program when asked about specific stressors. According to these sources, education level or lack thereof could affect the risk of harm to patients. Beneficence, which is the good to provide a good or benefit to persons. There is no question that nurses with ADN degrees provide much good and many benefits to patients. However, the research shows that the good and the benefits provided to patients are greater if a nurse possesses a BSN. Nursing as a profession should strive to provide the most good to our patients. Higher levels of education enable individual nurses and collectively the entire profession to provide better patient outcomes, save valuable resources, and positively promote nursing as a whole. Thinking about the evolution of my thinking personally, I entered the profession with an associate degree. I then went back for my RN to BSN, ultimately obtained my master's in science, and now I'm working on my DNP. So I'm clearly able to see each step of the nursing education journey and understand the separate bodies of knowledge obtained with each degree level. I've worked with many great ADN nurses who have excellent skills and excellent knowledge. And when I was an ADN, I felt that I had the knowledge and skills necessary to provide the best care to my patients. That is, until I received my BSN and quickly realized that there was much more to being a nurse than I had previously experienced. That thought process continued as I completed my MSN and now as I am in the DNP program. Each degree has brought clearly an increased body of knowledge that is absolutely paramount in being able to provide the best nursing care possible. It is through this progression of my own knowledge attainment that helps me to be convinced that the Future of Nursing initiative is correct in recommending that there be 80% of BSN-prepared nurses by the year 2020. Finally, the 40-year trend of the ADN being the most common way to enter the nursing profession is changing. Proper education does not include multiple options any longer. In order to meet the demanding, challenging, ever-changing needs of the U.S. healthcare system, the largest group of healthcare professionals, which is nurses, must be appropriately educated. The IOM report recommends that 80% of RNs be BSN prepared by the year 2020, and that is less than 4 years from now. So there is much work to be done by many sectors of this profession. Administrators, educators, and policymakers alike must continue to work together to make the RN to BSN journey attractive and feasible. Those who obtain terminal degrees in this field should pave the way by setting examples and removing barriers. The second discussion question to think about is, in general, do you believe that BSN-prepared nurses are better equipped to properly handle ethical dilemmas? And that concludes my presentation. Here are the references. And I'm happy to answer any questions. You may email me at slmcrae@king.edu. Thank you.